This. Hey there, this is Pastor Tim Gillespie. I'm here in my garage studio, and with me is Dr. Chad Vercio. Chad, tell us a little bit about yourself, your position, and what you find yourself doing nowadays.
Thanks, Tim. Yeah, I am the chair of Pediatrics at Riverside University Health System. I'm hired through Loma Linda. We have the contract for pediatric services at RUHS, and so I've been there for the last 2.5 years as the chair. Have been pretty heavily involved with our COVID efforts there, which have really ramped up over the last 2 weeks. Really planning for how do we prepare for this and make sure that we take really good care of our community. It's been occupying probably about 3 to 4 hours a day of my time over the last 2 weeks, and we have a team that's spending way more time on it than that. So just wanted to help our crosswalk community be aware of what they can do, the information that's out there, and hopefully help understand the complexity of this situation. Want people to understand that this is serious, and you need to do what you can to prevent you and your family from getting this, but also hopefully that we don't have to have a spirit of fear, and that of course God will be with us through this time.
Oh man, thank you for this. I'm really appreciating our time because this has felt like a moving target over the last few weeks of like, do we wear masks? Do we not wear masks? Is it the flu? Is it not the flu? So I know you've put together a PowerPoint. I'm going to share my screen and put it up there. You just tell me when to move to the next portion or whatever, and I'll be your video DJ for this information. Let me pull this up real quick.
Sounds good. You look like my DJ, on the screen as well. So, so yeah, I think like you alluded to, this has been really confusing for people because there's been a lot of things said in the media by the federal government, by various figures, what this is and what it isn't, and I've heard a number of comments. When I'm interacting with people on Facebook, there's a lot of things that I see. Sorry about that. There's a lot of things that I see, and so I thought I'd kind of address some of those heads ups or right up front. So one of the things that you hear is, well, it's just the flu or it's just a cold. It's not worth the economic effort and that kind of thing. And that really only the elderly or people with high risk conditions are affected. And I don't think that any of those things are really necessarily true at this point. And so I wanted to kind of share with Crosswalk community kind of some information about this so you can be informed and understand some of this, conflicting information and what's been kind of a confusing roller coaster ride.
Awesome.
So yeah, you can go to the next slide. So wanted to point out some of the significant differences between the influenza virus and the virus that causes COVID-19. One of the big things that makes these difficult is that the number of days between when you might be infected and when you start to see symptoms for the flu is way shorter than it is typically for the COVID-19 virus. So for the flu, it's generally 1 to 4 days, whereas for the COVID-19, it can be 2 to 14 days. And so you could potentially have somebody who was infected. They really don't have any symptoms, and they could be actually spreading this to other people for a period of time while they don't have any symptoms. And then they could then develop symptoms and have symptoms for several days and actually potentially be hospitalized maybe 3 weeks after they were originally infected. Wow. And so that's one of the things that's really challenging, I think, for people to understand is they look at the numbers and they think, wow, the numbers aren't that high. Well, that might be because we have all these people that are infected but haven't developed any symptoms yet. So that's one of the big differences between the flu. The other thing is that for the flu, generally you infect, for each person, they would infect 1 to maybe 1.5 other people with the virus. Whereas COVID-19, from what it looks like, is maybe 2 to 2.5 people. So it's a lot more infectious than the flu. Symptoms are often quite similar, fevers, coughing, although the flu probably has more GI symptoms. COVID definitely can cause GI symptoms. And overall, the symptoms, are quite similar. It's just often slower onset with COVID-19. this is where things get, I think, a lot different, is in the hospitalization rate and the mortality rate between the two. So generally, the hospitalization rate for flu is about 1 to 2%, whereas COVID-19, it's really hard to say right now exactly what it is because there are so many people that are asymptomatic. But for people that are getting tested and evaluated in the ERs and things like that, it seems like it's 10 to 20%, which is obviously dramatically
Wow.
higher.
Yeah.
And then the mortality rate is significantly higher as well. It's hard to say because so many people are asymptomatic, but it looks like it's probably in the 1 to maybe 3% range. Whereas for the flu, it's generally, under 0.1%. And so this is something that I think we all need to take very seriously and do what we can to prevent this. Again, not living in the spirit of fear, but doing what we can to help others that might be in high risk, have high risk conditions. So
Wow.
any questions you have about that so far?
No, man, the mortality rate is the thing that strikes me as pretty profound, which is not necessarily what we've been hearing, at least from the beginning. It's kind of like, oh, it's, the flu has killed so many more people, but the mortality rate on this is, exponentially greater, it seems like.
Right. Yeah, definitely so. And that's one of the reasons why it's really important for us to do what we can to minimize our risk. But I think really, which we'll get to at the end, but really important to do what we can to support members of our community, within Crosswalk, but also within our area, because there's so many elderly people in our area that are really high risk and shouldn't be going out to, to areas where they heighten that risk.
Right. For sure. Excellent, man. Thank you so much.
Yeah. So you can go to the next slide from here. So this again looks a little bit at other viruses that are out there that people have probably heard of. So we talked about the flu rate of how many people generally get infected, and so you can see the SARS virus, which fortunately hasn't really didn't become quite the issue that COVID-19 has been. Infected 2 to 4% of people, and the Middle Eastern virus infected quite a few, but fortunately was able to be kept from spreading. We can be thankful that didn't spread, because the mortality for that is actually about 40%.
Oh
So
my
it's a
goodness.
dramatically higher mortality.
Wow. No, this is a
Yeah.
really helpful illustration.
Yeah. All right. So this is, I'm sure quite a few people have heard about this, talk about flattening the curve. And this really shows, why that, in a very simple graphic, why that's important. So you can see the peak in red is really, if we were to take no measures at all, and just allow this to run rampant, that's, kind of the predicted peak of how things would go. And you can see that the capacity for healthcare would be really, really overwhelmed. And and that means several things. That means that our healthcare providers wouldn't have the equipment to adequately treat patients that need to be hospitalized. That includes ventilators, that includes IV pumps, that includes oxygen, that includes all kinds of things. Also, the personal protective equipment for providers, would be exhausted as well. And so there's all kinds of reasons to really do what we can to flatten that curve, to use kind of a cliche term, that will kind of spread out the time that the virus will be probably circulating in the community, which does make it in a sense a little bit difficult. But in order to really positively affect the way that healthcare is able to adapt to the situation, that's really important.
Yeah, I think the meme that I've seen that has had maybe the most impact on me are those matches all lined up and then one taken out, and you can see that it's not going
Right.
to go to the next person, which seems like
Right.
a relatively simple philosophical statement, but it seems like it's pretty powerful to really isolate so that we don't allow that to spread.
Right. Yeah, that I've seen that meme as well, and I thought that was very powerful. There's also some really nice illustrations that the New York Times has on kind of a uh, hypothetical community, where they show the transmission with and without kind of the measures to slow the spread of infection. That was really interesting. So it kind of gives a graphical representation over time.
Mm, awesome.
Yeah.
Awesome. Here's the next slide for you.
So this is really intended to encourage the boomers in our community to take this really seriously. So this looks at the mortality rate by age group, and you can see that, you know, fortunately I'm internal medicine and pediatrics, but I'm primarily doing pediatrics at this point. So in a sense, as a parent and as a pediatrician, I'm thankful that it's not affecting pediatrics to the degree that it is adults. So, you know, for your kids, still want to do what you can to prevent them from getting infected. But if they do, it's not as big a concern. And so you can see kind of as you get older, especially after age 60, the mortality rate significantly increases. And this is why I think we, again, need to do what we can to support members in our local community that might have difficulty getting access to food or other supplies without going out into public, which puts them at risk. And so, you know, you can see that those over 80 have a very, very high mortality rate. And so we need to do what we can to support those members of our community.
Absolutely. And just if you're listening to this, volunteer at crosswalkvillage.com. We can get you connected with anyone who needs help. And here's an interesting thing, Chad, that we've had a lot of people sign up that want to help. We've had very few people sign up that say they need help. Now that speaks to one of two things, I think. One, that we have a great community and great families that are taking care of one another, which is what I really hope it is. Second, could be that some of the older folks are not necessarily taking it as seriously as perhaps they should. And so we want to encourage you, if you would rather stay at home and let somebody do your shopping for you, we've got that covered, and we would love to help you do that if possible. So that's my little PSA right there.
Yeah, no, I was talking to Pastor Mike about this the other day, and we were talking about the same thing. I think it's really challenging for that generation, or for older generations, to not think of being independent. And yet, you know, I think hopefully this illustrates like how important it is to really limit their risks. You know, all of us that are of the younger generations, we want our grandparents, or we want our kids' grandparents, to be around and really be able to, you know, partake in what our families are about. And so, you know, for a time, I would encourage us you know, those of you that are boomers, and to really take advantage of the offering of the community, to limit your risk.
Absolutely. I think that makes sense for sure.
So this, I wanted to, you know, provide some California specific data in this as well. This is from healthdata.org, and you can find this, you know, on your own. You can look at California specifically, you can look at other states, and it shows basically the number of beds that are needed, that are projected to be needed, the number of ICU beds that are projected to be needed, and that kind of thing. It's very interesting to look at. And you can see here, you know, obviously all of this projections, and we're going to talk a little bit in the next slide as well, that, you know, there's variation as far as how these projections are being done by county. And so this, you can see in the purple shaded area is kind of the range of projections. So, so you know, there's obviously a huge range in that, and
Right.
the purple dashed line is kind of what the most specific projection is. So fortunately, California as a whole is not projecting that there would be more beds needed than are beds available. So that's good overall. Now, if you look at the number of ICU beds available and the beds needed, those numbers are very, very close.
Right.
So, you know, 1,900 beds needed in California, and there's 1,993 beds available for the ICU. So those are very close, very little margin for error, you know, with this. And so, you know, again, very important to do what we can to flatten that curve, so that people that need ICU beds, we don't really overwhelm the system and then have to make extremely tough decisions like they're apparently having to make in Italy and even potentially in New York. Now, one of the things that's distinct about California is we have a significantly higher elderly population than other states. And so, you know, this is something we have to really, really take seriously.
Because the needs for ICU beds does not take into account anything else other than COVID related issues. Is that correct?
Right. Yeah. Yeah. That's my understanding of these projections. Yeah.
Okay. Do you know, and this I'm putting you on the spot here, but do you know how many beds are used on any given day in California?
No, I don't know across California. I can speak a little bit to what we're observing, across our region, and that's generally that the ICUs are full,
Mm.
of non-COVID patients, and
Wow.
so, we're close to full, and so having a significant surge of patients that have a new disease process is going to be really challenging for the area, the region to absorb.
Wow. Interesting.
Yeah. So this is based on Riverside County's projections, and you can get this again on the county website. So this is one of the graphics that Dr. Jeff Leung has put together, and I think very, very informative. I already said that the projections between California overall and locally are a little bit different. I have to say his are much more severe, and that's why again I think we need to take this very seriously locally. That the number of projected ICU beds is potentially going to be more than we have capacity for currently. So I can't speak as much to San Bernardino County because I'm not as involved there, but I can speak to Riverside County, and that they are very, very proactive in planning for this. So I want to reassure the community that you have people that are much more intelligent than me, much more creative than me, dealing with this, and really trying to do the best for our community possible. And they have been extremely proactive. I really can't highlight that enough. Um, so we're trying to figure out how do we increase that capacity, if we need it. And so we're running through all kinds of scenarios and ideas of how to do that. But wanted to kind of tell you a little bit on how this is projected. So that's in part based on the doubling time, which is how often we go from, say, 1 to 2 cases, and 2 to 4, and 4 to 8, and 8 to 16, and so on. And so you can see on the left side that the doubling time is about 4.7 days. Fortunately,
Okay.
that's not as bad as it could be. Countries that have been dealing with this very severely have had a doubling time of around 2 days, but that's also not as good as it could be. And we'd really, really like to see the doubling time slow down to 7 days or 8 days or even longer, which allows us to have more leeway in adapting and preparing for dealing with the level of ICU and medical care that's going to be necessary.
Right.
This was also based on the number of deaths in Riverside County. So this is available on the county website. That's where I pulled it from.
Excellent. There's a lot of information there.
Yeah. So this kind of shows the trajectory of the U.S. overall, and you can see kind of the doubling times. U.S. is highlighted in green, and this is from the European CDC, Our World in Data. It's a very, very interesting thing. You can look at different countries and kind of what their doubling times and things are. And this is obviously tracking over time. And you can see that the U.S. is nowhere where we need to be, which was, further towards the right, with a doubling time of, it'd be optimal to be between 5 to 10 days or so. And so, yeah, just, we've got to do whatever we can to slow things down.
Wow. Absolutely.
So this shows kind of the trajectory of different countries, and you can see the U.S. Was skyrocketing. Part of that, to be fair, is a little bit because we didn't have testing for quite a while, and we really struggled with getting widely available testing. That has improved somewhat. I can't say it's improved to the place that it needs to be, but part of that increase in trajectory is just because of that. I wanted to call out, one specific color on here, which we'll talk about in a minute, which is the purple, and that's South Korea.
Right.
And they have been very, very effective in controlling this, more so than probably really any other country. And so, I think there's a few things that we can learn from them as we try to deal with this ourselves.
Right. What are those things specifically, or am I jumping ahead?
You're jumping ahead. So
I figured
we can go
I
to the
figured I
next
might
slide.
be. Okay.
So yeah, the methods to flatten the curve, and these are not necessarily, I'm saying we have to do these, but these are obviously some of the things that we're doing. So social distancing, really trying to maintain basically, Governor Newsom's recommendation to shelter at home. Really avoid minimal contact with people outside of your home. That's one of the important things. And I'll say this, I was on our call this morning. Based on cell phone data, Northern California has had a 90% decrease in travel,
Wow.
whereas in our area, it's been only a 40 to 50% decrease in travel.
Hmm.
Part of that is maybe because we're more spread out, and so people are commuting long distances. But whatever we can do to minimize, exposure to other people in the community, because we can spread it asymptomatically, or they can spread it to us asymptomatically, will work to flatten that curve and decrease the number of people that get infected and then get ill, that have to be hospitalized. So
I
that's
s-
one thing.
yeah. Talk to me about
Yeah.
Talk to me about masking, because that seems like we've had a few different, messages coming from the idea that you should wear a mask when you go out, or you shouldn't. It's only for
Right.
those who have it. Like, tell me a little bit more about that.
You're jumping too far ahead of me,
I'm
Tim.
sorry. I'm sorry.
That's okay. No, we'll get there in just a second.
Okay.
So the other really important thing is effective testing. That's what I think South Korea really deployed very rapidly. In a sense, I haven't followed theirs extremely closely, so I haven't read all of the data that's come out of South Korea. But from my understanding, they did get a little bit lucky in that a lot of the people that were initially infected were young people, and this spread from actually mega churches, from what I understand.
Hmm.
And so, those were people that were less likely to get severely ill. They were, because of the rapid testing, they were able to isolate those people very quickly. And that was really what helped them control the spread. So that brings us to masking. And this has been confusing. I'm gonna, before we get fully into that conversation, I want to cover the other things. But masking is something that has been helpful in South Korea, and they did widely implement that. The other thing is tracking. So the ability to track people, and know who's positive, and that kind of thing, which our public health officers are really trying to do. But there's so many people that are asymptomatic or only mildly symptomatic and not being tested, that's really difficult. And so and we may not have as robust tracking mechanisms within our governmental institutions to be able to do that. And then the last is forced quarantine, which, I'm not suggesting we do this by any means. I think that would be, not necessarily something I would, recommend or say is super effective, but it is one of the things that countries have used. And so what I was going to say is that countries that have done 3 of 5 of these things effectively have really had an impact on flattening the curve.
Okay.
And so, so social distancing, hopefully we'll get a lot more effective testing quickly, and then masking. So we can move to that discussion now if you want to go to
Sure.
the next slide.
Sure.
This, I guess, goes to the testing, which is, you can see on here the size of the dot on the left-hand side is how many tests were done based per million people. And you can see South Korea did way more tests per million people. And unfortunately, U.S., we have one of the smallest dots, but we have one of the biggest populations. And
Right.
so that's one of the things that makes this really difficult at this point in the U.S. All right, now we can go to their discussion.
Okay.
Ah, crap. I didn't get that out. So the high risk conditions. So the high risk conditions, really wanted to reiterate this so people are aware of what these are. Age greater than 65, we already talked about that. I would really consider lowering that to 55, 60. That if you're that age, really do as much as you can to stay in your home or away from other people. I fully believe in getting outside and getting sunlight and that kind of thing. But just doing that in a way that you're not exposing yourself to getting infected. And then people in long-term care facilities are definitely at higher risk. We've seen that with a couple of outbreaks locally recently. And then if you have, moderate or severe asthma or other chronic lung diseases, definitely, if anybody's smoking out there, I would quit that for now.
Right.
Cardiovascular disease, being immunocompromised, and then severe obesity or diabetes, chronic kidney disease, and chronic liver disease. So these are the kind of people that I feel like our community really needs to support. And I'm glad, really glad to hear that it really has been trying to support these people, within our church. And we need to figure out how do we do this and advocate for this in our local area as well.
Right.
So. All right. So yeah, what you can do, stay home. I already talked about this, I think, ad nauseum, but the masking. So to go to that, this has been confusing. And, even personally, I think, this has been a little confusing to me over time. Typically when we're in flu season, we don't mask because it's really not shown to be effective to prevent me from getting an infection.
Mm-hmm.
So I don't wear a mask with somebody with the flu because it's, a surgical mask at least, because it's unlikely to protect me from getting the infection.
Right.
But what is becoming kind of more thought of is because so many people are asymptomatic and spreading this, or could be spreading it, that it could be effective in preventing that spread. And there's some data, in studies to support this. I was reading a study that they had people with no mask, people with a surgical mask, and people with an N95 mask, which is kind of the really airborne protection mask, cough into a petri dish, and then they kind of measured the viral load. And people with a surgical mask also didn't apparently transfer that to the petri dish. So there is definitely some evidence that it really might decrease transmission. And so Riverside County has just come out with a recommendation that everybody wear some type of face covering whenever they're out in public. And so if you're going to the grocery store, I definitely would wear a mask or cover, some type of face covering. We want to make sure that the surgical masks are there for healthcare providers.
Right.
That's one of the ways that, we're protecting ourselves for them and protecting patients from this asymptomatic spread. So, a bandana or a scarf or some kind of thing to just basically cover your breath as you're, exhaling, really may help to decrease the spread. And again, this is something that's commonly done in Asia. Those of you that have traveled in Asia, you'll see, people in the airport with masks on. And I had always kind of thought, well, that's kind of silly. And in a sense, it might be because it may not be protecting them if nobody else is doing it. But if everybody's doing it, then it really may help protect all of us.
Right. It's going to help for sure.
Yeah.
Absolutely. Oh, what? This is lots of vegetables.
Lots of vegetables. Yeah. So obviously eating healthy and, we talked about sunlight and getting outside. Those are important things, but this was really to get, go back to, again, the idea of what can we do to grocery shop and do things to support the members of our community that really shouldn't be going to do these things.
Right.
And it really might be an adjustment for them to think about not doing these things.
Mm-hmm.
And so, yeah, I just wanted to, remind people, and so glad that Crosswalk's been a community that's really been committed to supporting these people. And a lot of people have to do that.
Absolutely. And we want to do more. So if that's something that you guys need, if you're watching this, we want to reach out to us so we can help you guys out for sure. Oh, this is an interesting slide. Tell me about this one.
Yeah. So this was, I had been thinking over time about, and this was actually before this. I was attending a class recently for students on missions in healthcare. And in that class, Dr. Kevin Shannon, who's one of the members of our congregation as well, really talked about the role of Christians in healthcare, even very early on, and highlighted that, one of the reasons for the growth of Christianity was actually plagues,
Right.
because Christians responded so differently from those of other worldviews to the plague. And so, I just wanted to highlight that that's been our history, and that should continue to be our present and future. And I was reading an article on this that I think, put it very cogently. I found it was very interesting. It was actually in the website for foreignpolicy.com. But this quote that the author put was, "For Christians, it is better that we should die serving our neighbor than surrounded in a pile of masks we never got a chance to use."
Wow.
And so, many of our members are in the healthcare community, and definitely we want to have adequate protection for all of us that are serving in healthcare. But But we shouldn't be living in a spirit of fear and trying to isolate ourselves to the point that that we're not helping people that really, really do need that help.
Right. No, I really appreciate that. And I think, is this the last slide? I think that it is.
That is the last slide.
So I'll stop screen sharing right there. But I really appreciate you ending on that. I teach at Azusa Pacific University in their nursing program. And one of the things we talk about is why the early Christian church continued to grow. And it was through the compassionate care that they gave. And it was specifically through the plagues that they dealt with in the first 300 or 400 years of Christianity. And we're at that place again. And I'm so incredibly proud and thankful for our healthcare professionals, not just in our congregation or our denomination, but anyone who puts themselves on the front line. It's just amazing. And I appreciate what you do, Chad. You've been a part of our leadership team here at Crosswalk Church, and now you've taken on this role as head of pediatrics over at University Hospital in Riverside. We're really thankful for your time, and we're thankful for this. Any last words that you'd like to say as we leave?
No, I mean, I think that it's amazing to see the adaptability and creativity that you as pastors have had to do. I imagine that it's taken an immense amount of work to accomplish what you've been able to do so far. And I have to highlight my colleagues in medicine. I mean,
Yeah.
and not just the doctors and nurses, but our colleagues in information technology. I mean, it's been incredible what they have done in the last couple of weeks. Rollouts that would take months, typically we've done in 3 days.
Wow.
It's really been phenomenal to be supported by information technology, nursing, physicians, and see everybody working together, really trying to encourage one another, and do what we all can to support our community. I mean, I think that's what all of us want to do, is just see the best outcomes for our community. So.
Wow. That's awesome. Well, Chad, thank you for your time. I really appreciate it. And if you guys tuned in and you listen to this and you watch this, any information that you need, any questions that you have, you can always email crosswalkvillage.com and we'll get them to Chad, or we'll get them to Casey, some of our other physicians in the community that can help answer those questions. If you have anything going on, you can always just email office@crosswalkvillage.com. Chad, thank you. I really appreciate it. And your time is incredibly valuable. So we're really grateful for it.
No, thank you, Tim. Glad to be a part of the community.
Absolutely.